and thank you to be there. My name is Teresa Casanovas. I am a pathologist, and now I am ELPA Scientific Committee Coordinator. I would like to start saying that ELPA is joining the efforts of different European organizations, in particular coming from the scientific and community fields, which are concerned about the increasing number of people with alcohol-related liver disease in Europe. We have the great opportunity of having Dr. Salvatore Piano, who is a clinician expert. He is a pathologist working at the University Hospital of Padua in Italy. He is clinical researcher. He is member of the editorial board of the top-level journals of hepatology, and he is committed with ELPA and collaborating with liver patients in our fight against liver diseases related to alcohol. My first question, Dr. Salvatore Piano, is how to make the diagnosis of alcohol-related liver disease. It is challenging to achieve a correct diagnosis and avoiding stigma.
First of all, hello everybody, and thank you, Teresa. Usually alcohol-related liver disease is suspected in subjects that have a regular alcohol consumption higher than 20 grams for women or 30 grams for men. So in this subject, the screening investigations for liver disease should include both liver function tests and a test able to measure liver fibrosis, such as transient elastography. So the early identification of alcohol-related liver disease is very important because usually this disease is diagnosed in advanced stages when the therapeutic options are limited. Therefore, the screening of alcohol-related liver disease is very important and should start in primary care. As for stigma, the physician attitude is very important because negative attitudes of healthcare professionals toward people with alcohol use disorder or alcohol-related liver disease are common and can cause suboptimal healthcare for these patients, but also their perception of being stigmatized. Therefore, the attitude should be positive, and we have to discuss with the patients about alcohol use disorder and alcohol-related liver disease as chronic diseases such as many others, like diabetes or hypertension, and not like a bad behavior.
Thank you. Thank you, Dr. Piano. In your opinion, would we reduce premature morbidity and mortality? Which public health policies are required to decrease alcohol-related liver disease and other non-liver-related consequences, such as car accidents, violence?
Well, this is a very important point. We must definitely tackle alcohol-related morbidity and mortality. Alcohol-related liver disease is just one among the negative consequences of the exposure to alcohol. Alcohol is one of the main risk factors for cardiovascular disease and for cancer. The excessive alcohol consumption can cause car accident, can impair person judgment, increasing the risk of aggressive behavior and violence. And, on public health, there are several potential effective policies. I will just mention three. First of all, to increase taxation on alcohol or establishing a minimum unit alcohol pricing. 2, limit the availability of alcohol. And 3, to restrict taxation and minimum alcohol unit pricing. Restrict advertising. And among all these three, the most effective one is certainly the increase in the minimum alcohol pricing. There is evidence that the increase in minimum alcohol pricing can reduce immediately the amount of alcohol consumption, and the effects in terms of reduction of alcohol-related mortality can be observed already 1 year after the implementation of this policy.
Thank you. Now, I would like to talk about teenagers and alcohol. We know the risk of binge drinking and brain damage. How to inform the younger, and what would be the advice for parents and for teachers?
Well, Teresa, this is again very important. Usually, alcohol starts in adolescence because the adolescent, want to assert their independence, are seeking new challenges, and drinking is one such challenge that attracts many adolescents who frequently are not aware of the dangers caused by alcohol consumption. In addition, although during adolescence, the young people drink less often than adults, when they drink more, and usually with binge drinking, that means the consumption of very high amount of alcohol in a very short time. That is the most dangerous type of drinking. The intervention should be school-based, social media-based, family-based. There are several ones, but everything is going through the education of these young people. And in the family, we should try to empower parents to set and to enforce clear rules about drinking and alcohol consumption, and also to improve the communication with their children or their adolescents.
Thank you. And now I would like you to explain some worries that affect women in particular. The risk for the baby if the mother takes alcohol during pregnancy. And another question, if it is true that drinking alcohol increases the risk of developing breast cancer?
Well, Teresa, women are certainly at higher risk of developing complications of alcohol consumption, such as alcohol-related liver disease. But talking about pregnancy, we know that alcohol consumption increases the risk of miscarriage, premature birth, low birth weight, and it is also associated with a specific group of syndromes that are called the fetal alcohol spectrum disorders that can severely affect the newborn. Therefore, any alcohol use must be avoided during pregnancy and also during the breastfeeding. Moving to the risk of breast cancer, I can absolutely confirm that drinking alcohol increases the risk of breast cancer, as well as other many cancers such as gastric cancer, esophagus cancer, throat cancer, and bowel cancer.
Yes, thank you. And the last question. What is your opinion about what liver patients should do to increase awareness of the problem of alcohol in Europe? Our fights against stigma, and also considering that we belong to countries with a rich production of wines and liquors, and it can affect the economy.
Well, Teresa, it's very important that patients join their efforts and build up a network of patients' organizations such as ELPA, that is a perfect example, that try to make a contact with all the stakeholders, such as the policymakers, the health professionals, in order to develop information campaign in which they are directly involved. Moving to the stigma, the fight against the stigma is very important because it leads to discrimination. So the stigma leads to discrimination, the reduction in healthcare seeking behavior in patients, the reduced allocation of researchers, all of which result in poor outcome for the patients. Therefore, the fight against stigma requires education of the public, but also education of healthcare professionals. And in this regard, it is important the involvement of patients with lived experiences about stigma. Moving to the conflict of interest in countries that produce a high amount of wines or liquor, I can tell you that this is very relevant, but what healthcare professional and patients organization should do is try to join their effort to contrast the lobby activities of alcohol industries on policymakers.
Thank you. And thank you for your words this is the end of our interview. Your opinions are very relevant for ELPA and for all the citizens, because alcohol-related liver disease is the major cause of liver disease in Europe, and it's a preventable disease. ELPA, as the biggest European liver patients association, is concerned about the fact that patients receive their diagnosis too late. Therefore, we consider that the information about alcohol toxicity and associated risks is crucial for citizens, patients, and families, healthcare teams, healthcare managers, and politicians. So all would require more information on this issue. Thank you very much.
Thank you. Bye.